मैले जसले रोल नम्बर राखेको छैन उनीहरुलाई रोल नम्बर राख्नु भन्नु किनभने रोल नम्बर नभएको जति सबै यहाँ चाहिँ रिमुभ गर्दैछ है
ए हजुर सर
तपाईलाई ask them to put their roll numbers otherwise they will be removed from the list. I can see even one Devendra Khotka right here, Vikas Rauniar, and then some others have already been removed, but they can now put their roll numbers back and then re-enter.
Awesome.
Okay. Can you hear me? Hello, can you hear me? Okay. Keep an eye. Yes sir, yes sir, yes sir, yes sir. Okay. Now I'm going to start today's class. Good morning, namaste, not good morning, namaste. Okay. I just want to remind you, our pandemic days with the namastes from the Western people, the President Trump and other people there. Now, last time in my last lecture, we discussed what oral cavity is, what are the boundaries, and what are the most important structures that you can see within the oral cavity, identify them. The floor, the mouth, the floor, the roof, and then we also talked about soft palate, a little bit of soft palate, and the functions as well. So today, now I want to go right into the oral cavity and give you some, ideas about, what teeth are like, what teeth are, how do you make yourself familiar with the teeth within the oral cavity. So it's not possible to go into details of dental anatomy because this is in itself a vast subject, but then I'll give you some idea that will help you recognize different teeth or different classes of teeth and how to note them in your clinical chart. That's called clinical notation. And what are the actually deciduous dentition and then permanent dentition? What are the most important differences between the teeth belonging to deciduous dentition and permanent dentition? And then also, what are the different types of teeth that we have present within the oral cavity? Although they look very similar, but they are of different classes, types. We call them as a different classes. And they're probably there, if we have time, probably their eruption dates and then some important features of these dentitions. Okay. Now, okay. So you have seen this, seen this scene so many times in your life. When patient opens her lips, what you can see, anarko jasto daataharu, lataramma pareko anarka danaharu. That's what we usually say to the teeth. Okay. So the part of the teeth actually which you see in the oral cavity when somebody opens mouth, the whitest part, they are actually known as crown. Okay. So they are known as crowns. So all these individual, white looking structures that you can see in the oral cavity below the gum tissue, they are actually crowns. Although a part of the tooth, but they are known as crowns. Okay. Now, crown, actually, when you say crown, actually, you know what crown is. The kings, the emperors, they wear it. So the tooth which wears this. That's why they are given name crown. Now, if you go into the detail of each individual tooth, okay. Now, I have shown you the crown, okay. This is actually a model of a tooth, okay. So this is the crown, and then the part of the tooth which you can't see in the oral cavity normally, that is known as root, okay. So our tooth basically has two parts, a crown and the root. The crown you can see in the oral cavity when the patient opens your mouth with your eyes, but the root is embedded into the bone of the maxilla or mandible. That's why you cannot see it unless there's some kind of disease and the root is exposed. Okay, and there's one line of demarcation between the crown and the root. This line of demarcation is what is known as cervical line or neck. Okay, so this line which demarcates between the crown and root is known as cervical line. Okay, now what are the functions of teeth? Okay, what are the functions of teeth actually? So many of you know already, the functions of teeth. Just to recapitulate, the mastication, you already know it. See, the teeth are basically meant to chew food particles into small pieces so that the surface area for the action of digestive juices, okay, the surface area is increased. So we'll have a better digestion. So we have teeth which actually cuts the food particle. When you take a piece of food, the first of all, the cutting teeth, they cut them into small pieces, and then there are some teeth which pierce meat and then break down them into small pieces. And then we have teeth in the posterior position, which actually they function like kind of grinding machine. That's what we call molars in Greek word, molars. So these teeth actually they grind them into small pieces so that the digestive juices coming out of salivary glands, they can act upon these food particles minutely and then get a better digestion and so better energy for the body. Okay. Now, as I mentioned you, mastication means nothing but cutting food into pieces and then piercing meat and then grinding them down together is known as mastication. Now, next is helps in deglutition also. Okay, as I mentioned you earlier in my last class, see, when you want to swallow food particles, you have to make a bolus, okay, and then put your tongue into the back of your upper teeth and then start perithalsis so that food will be pushed backwards into the oropharynx. Okay, so that helps in deglutition also. So if you don't have teeth there, you'll have trouble. Although you can do it, but it will be difficult. And then articulation of speech, you know it. Articulation of speech is very, very important because as I mentioned you earlier, okay, that sound is produced in the larynx and the vocal cord, and then that sound is converted into different types of speeches, okay, with the articulation at different locations. Now, today I want to tell you one interesting thing, okay, one very, very interesting thing that, see, we Nepalese people or we Indian people, okay, we speak Devanagari language, right? Now, Devanagari language is, very, very scientific language. If you think of the English language, beauty is pronounced as but put is pronounced as put. Same thing, you, okay? So you can well imagine, how their languages, they are not scientific at all, okay? But if you look into the Devanagari or our Nepali language, their production, their articulation is so scientific. Okay, for example, say ko, kha, ga, ga, nga. Okay, the first line of our alphabets, they are produced by the velopharyngeal articulation, right from the throat, velopharyngeal. Okay, you know that velopharyngeal articulation, and then after that comes cha, cha, ja, ja, ya. Slightly before that, ahead of that. And then when you talk about the ta, ta, da, da, ana, can you imagine that ta, ta, da, da, ana with your lingual, with your tongue and the entire part of the palate? Okay, ta, ta, da, da, ana. Can you visualize that? And then after that, what comes? Ta, ta, da, da, na. Okay, ta, that is tongue and teeth. Okay, then to lingual, ta, tha, da, dha, na, and then comes finally bilabial sounds, pa, tha, ba, ba, ba. Okay, now you can well imagine, how scientifically our language is made. Just a minute. Okay, right. Okay. So articulation in speech is very, very important. And now you can say which sounds are produced where, articulated where in our mouth. And then if you don't have those parts of the oral cavity or teeth, nicely made, or they're not there, you have lost them, then probably you will have difficulty in producing those sounds, speeches. And then another thing, aesthetics. Okay, aesthetics. Now you can well imagine, how many people are having braces these days, they're going for aesthetic fillings and all those things, crown and business works and everything. People are very, very aware of aesthetics. So these are the functions, okay? Mastication, deglutition, helping in deglutition, articulation, and aesthetics. Okay. Now another one, defensive. I talked to you about this last time also. Sometimes defensive also. You have to fight sometimes. You can use your teeth also, but you don't attack with that in the beginning. Now let's talk about the four quadrants in the oral cavity. Four quadrants. Okay. Bipanag, is it clear? Can you follow? Are you understanding? Bipana, is it okay my speed? Hello? Bipana?
हजुर सर
बुझिदैछ सुनिदैछ
yes sir राम्रोसँग बुझिरहेछ
Okay, thank you very much. Okay, all right. Now I'm going to talk about the mid-sagittal plane. Okay, all of you know mid-sagittal plane much better than I do, right? You have studied what is mid-sagittal plane. Can you tell me what is it, Vipana? What is mid-sagittal plane?
त्यो सजाइटल सुचरसँग करेस्पोन्ड गर्ने गरी मिड लाइनमा भएको प्लेनलाई चाहिँ मिड सजाइटल प्लेन भन्छ
What is it? How do you define it? No, just tell me, how do you define it? Mid-sagittal plane.
मिड लाइनमा चाहिँ अब सजाइटल उससँग सुचरसँग करेस्पोन्ड गर्ने गरी जुन प्लेन हुन्छ त्यसलाई चाहिँ मिड सजाइटल प्लेन भन्छ
What is the importance? What is the importance of this plane? What is the importance of this plane?
So it divides compartment into two equal halves.
Yeah, you're right. Come on. Divides the body into two equal
halves.
Do you think that is true?
Anatomically चाहिँ अब organ त कुन साइडमा हुन्छ अब कुनै organ लेफ्टमा हुन्छ कुनै राइटमा हुन्छ अब
Very good. You have only one heart which cannot be divided.
Yes, sir.
Right? The heart is on the left side, cannot be divided into two equal halves. But basically, volume-wise, it can be divided into two halves, equal halves. That's how we describe the mid-sagittal plane. Now, see, in our oral cavity also that holds good. Okay? Now, you are very familiar with this picture. As you said, with the coronal suture, this plane corresponding to that, dividing body into two equal halves. Okay? Now, when you come to the oral cavity, in the face, okay, we have one line. We have also that plane here also. And then this line, actually, which corresponds with this mid-sagittal plane, here we call this as a medial line. Remember it. We call this as a medial line. Okay, we don't call it a mid-sagittal line, but we call this as a medial line. Okay, see, you have to understand these things. This is very, very important because this is very useful for you afterwards when charting down the conditions or diseases of the teeth. Okay, so this is medial line. Now, apart from the medial line, we have another line which is corresponding to the occlusal plane. You know what is occlusal plane? You know what is occlusion? Occlusion is actually nothing, but it is the act of coming the teeth of upper teeth in contact with the teeth of the lower teeth. These are upper teeth, these are lower teeth. When they are come in contact with each other, they actually come in contact in one plane. There's one plane there. They make a plane with different tips of different teeth, like this. Okay, so this plane is known as occlusal plane. Okay, this is occlusal plane. You have lower teeth, you have upper teeth. When they are in contact, that is known as occlusion, and the plane corresponding to that contact is known as occlusal plane. And the line which corresponds to that plane is known as occlusal line. Got it? Okay, got it. Now see, this visual line and this occlusal line together divides our oral cavity into 4 quadrants. Quadrant number 1, quadrant number 2, quadrant number 3, and quadrant number 4. Clear? Okay, clear. Now, we call this as a quadrant number 1, but we also call them as a right upper quadrant. This is patient's right side. This is patient's left side. Or a person's right side, person's left side. Okay? So this is right upper quadrant. This is left upper quadrant. This is left lower quadrant. And this is right lower quadrant. Okay? There is another name for these quadrants as well. This is right upper maxillary quadrant, because this is maxilla. Okay, this is right upper maxillary quadrant. This is left upper maxillary quadrant. This is left lower mandibular quadrant, and this is right lower mandibular quadrant. Is that clear? Yes, good. Now we are taking those 2 lines into the oral cavity now. Okay. Now we have teeth here. We have teeth here. These are maxillary teeth. These are mandibular teeth. Now, when you divide them with the help of these 2 lines, this is right upper quadrant. This is left upper quadrant. Left lower quadrant. Right lower quadrant. So this is the quadrant. These are the quadrants actually. And then instead of right upper, this is right maxillary. This is left maxillary. This one is right mandibular. This one is left mandibular. Okay. Now, when you talk about this, you can say this is left mandibular teeth. Number 1, number 2. We'll come to that afterwards. Now, let's talk about human dentition a little bit. Okay. After knowing these quadrants, let's talk about the human dentition. See, we have our dentition is called diphyodontic. Di means 2. Diphyodontic. We have 2 sets of teeth. Okay, that's why our dentition is called diphyodontic. What are those two sets of teeth? The number 1, the first teeth to come into the oral cavity. The first sets of teeth to come into the oral cavity, they are primary teeth. Okay, first sets. That means primary means first to come. First sets of primary. Now, they are also known as deciduous dentition because these teeth ultimately shed off. Okay, they will be replaced by permanent teeth. They do not stay there forever. All of them will be replaced. They all fall off like deciduous trees. Okay, what happens with the deciduous trees? In the winter, all the leaves, they fall off. That's why they are known as deciduous trees. Similarly, the teeth belonging to the primary dentition or deciduous dentition, they ultimately shed off. They will be replaced by the permanent teeth. That's why they are known as primary or deciduous dentition. And they're all together 20 in number, 5 in each quadrant. Okay, I mentioned you about the quadrant. Now this is useful using here because all these 20 teeth, there are 5 teeth each located in each quadrant. Okay, so all together 20, and the first teeth to erupt in the oral cavity is at the age of 6 months. Okay. Now, remember, when I say 6 months, that's an average date. It's not an absolute value. Okay, it's not an absolute value. It's an average. Okay, some deciduous teeth, the first teeth they erupt around the month of 5, maybe some around the 4.5 also, sometimes 5.5 also, some even at the age of 7 months. So when you take the average of certain population, the average time is about 6 months. So it erupts around the 6 months of age. Okay, and then by the child becomes as old as 3 years, probably all 20 teeth will have been erupted. So when you examine the mouth of a child around 2.5 to 3 years, you will see there are altogether 20 teeth in his or her mouth. So 20 teeth, they constitute the deciduous dentition. But if you talk about the permanent teeth, we call them secondary because they come after deciduous teeth. Okay, they come after the deciduous. There are second sets of teeth to appear. That's why we call them as a secondary. But they are supposed to be in the mouth throughout our life. That's why they are known as permanent dentition. Okay, so consists usually of 32 teeth. Usually of 32. And the first permanent tooth to appear in the oral cavity is at the age of 6 years. That is also average time, 6 years. Some 5.5, some 6.5, maybe. So it's an average day. Okay. So when you look at the mouth of a 6-year-old children, probably you'll see some permanent teeth in the oral cavity. They have been replaced by, okay, some teeth. We'll talk about that in due course of time. So 6 years onwards, you have permanent teeth also in the oral cavity. Okay. Now coming back, as I mentioned you earlier, we have 4 quadrants there. If you talk about the deciduous dentition, you have four quadrants. In each quadrant, you have altogether 5 teeth in each quadrant, together 20 teeth. Okay. And then in the permanent dentition, we have 8 teeth in each quadrant, and then altogether 32. Now these days, the tendency is toward 28. Okay. Our ancestors were a greater number of teeth because they used to be dependent on having raw food, like prey, the meat, raw meats, eating raw meats, going to the jungles and everything. So they needed more teeth. Now, so-called civilized diet developed during our period probably has caused this evolution of only 28. We're going towards 28 now. Okay. Slightly before us, probably the actual number of permanent teeth were 32. Now our generation, probably your generation, is going towards 28 because you don't need as many as did our ancestors actually needed. Okay, because of the pattern of the food we're having right now. Lamarckism, okay, evolution, you know that already. Darwin, Lamarckism, you should remember that now. Okay. Now let's talk about the let's talk about classification teeth. Although when you look at this, when you look from outside, they all look similar. They look very similar actually, all white and kind of but actually, if you go into the details of this teeth, they are of different shapes because they have got to do different functions, as I told you earlier. Okay, so what are those 4 classes of teeth actually? Incisors, number 1. Class number 1 is incisors. What do you mean by incisors? You already know, to incise means to cut. Okay, to incise means to cut. You are the medical doctor. So you go to OT and you see your teachers incising tissues, with the help of a knife and everything. Incise. Okay. What do you do when you do a operation of soft tissue? First, you incise it. Okay, cut it. So incisors are supposed to cut the food particles. If you take a piece of apple, you put it here in the mouth. What do? You bite it. So what do you mean by biting? You're cutting it. Okay, you're cutting it into pieces, right? You're cutting into pieces. So what happens actually when you cut it into pieces, and then the posterior teeth? Similarly, canines, you can see here, canine. What is the difference between these incisors and then this tooth? You have slightly pointed cusp here. We call that as an elevated part. We call that as a cusp. Okay, there's a difference between this one. This is straight here like a knife edge, and this is actually slightly pointed. Now this pointed tooth, this pointed part is known as cusp, and that's why these canines are also known as cuspids. Americans would like to address this as a cuspids, not as canines, like Britishers they do. Okay, so cuspids means a tooth having a cusp. Now these cuspids are they are very good for piercing food particles. They are very good for piercing food particles. Like if you eat meat, and if you don't have canine, actually, you don't enjoy eating meat because you cannot pierce. Okay, so they are very, very important in this. Now let me take something more about canine. Susan, can you unmute, please? Okay. Now, can I talk to you?
Yes, sir.
So then, have you seen a movie called Dracula?
Yes, sir.
You have seen? Okay.
Yes, sir.
Okay, right. That's good. How many Dracula's movie you've seen?
2, 3.
2, 3. Very good. Does your friends also have seen Dracula movie?
I think so.
Okay. Okay. So what is so particular about Dracula?
Having large canines.
Exactly. That's what I wanted to ask you. Now you can unmute. Okay. Now see what I want to point out that actually the canine tooth is very, very important, giving the impression of a person, whether the person is more like a devil, whether the person is more like a masculine, or whether the person is more like a feminine. Okay. If you have a very prominent canine, long canine, then probably that person looks more like a Dracula. Okay. The ladies or girls or ladies, they have got less prominent canine. That's why that gives them a kind of feminine look. And we are in between girls and devils. Okay. All of us. Okay. So we have slightly more prominent canine than that of girls, but less prominent than that of devils. So this is very, very important to give the look of a person. Very, very good in aesthetic. And that's why we consider when you put braces and all those things, whether we want to keep it more prominent, whether we want to keep it less prominent, we want to give it a more feminine look, more devilish look. If somebody is angry with me and then asks me to put a braces, if I'm angry, then I'm going to give him a long canine. Okay, that's the point. Okay, to joke. That's just a joke, but that's what I want to mean. The importance of canine. Now we have then premolars. Next classes of teeth are premolars, but before that premolars, I'm going to talk to you about the fourth classes of teeth, that they are molars. See, if you look into the molars here, you can see some elevated parts here, some elevated parts here, some elevated parts here, these elevated parts are like this, cusps. Okay, and you can also see some depressions here, fossa. We call them as a fossa. Okay, fossa. Now, what you have to do is here, you have to imagine the pestle and mortar. You know what is pestle and you know what is mortar, right? In your pharmacy, you have seen that. Even in your kitchen, you must have seen that. You might have noticed that. Okay. So what happens actually? The pestle is grinding your masalas and everything like this. Okay, pestle, and this is mortar. So here in teeth, these fossae, they act like a mortars, and these cuspids, they act like a pestle. So you have a pestle here, you have a mortar here, and there are so many pestles and mortars in the molars. Okay, so with the help of your temperament of the joint, with the help of your muscles of mastications, say they move your pestles and mortars, multiple pestles and mortars in such a way that you can grind the food particles down into fine pieces. Okay, so they are, because they grind down. In Greek word, grinding means mola. Okay, mills means mola means mills. That's why they are grinding teeth. So the fourth classes of teeth are grinders. We call them as a molars. Okay, and then the premolars, they are located in front of molars, but behind the canines. They have two cusps. Okay, they have two cusps. They don't have many cusps, but they have two cusps. So they are also sometimes known as bicuspids. Okay, two cusps, having two cusps, bicuspids. But because they are situated in front of the molars and behind the cuspid canine, so they are known as premolars. Okay, because they are located in front of the molars. That's why they are called premolars, before molars. Okay, and the function is intermediary between the canines and the premolars, because they are located between the canines and premolars. So function is intermediate. They do a little bit of piercing and they do a little bit of grinding. Okay, so basically we have four classes: incisors, cutting; cuspids, piercing; molars, grinders; and then premolars, they have intermediate functions of canines as well as molars. Okay, now you see the incisors here. Okay, incisors, you can see fine edge cutting teeth, incisors, see, and then you have cuspid here, you have premolars. Okay, 2 premolars, 2 cusps, and then you have multiple cusps here, 4 or 5 in molars. Incisors, 2, canine, premolars, and molars. Premolars because they are located in front of the molars. Okay, that's clear. Now cuspid you can see here, pointed. Okay, this is cusp. It's not straight like this, but it's pointed. Okay, molar you can see multiple cusp here, and then foci here. The lower cusps they come here, and then this upper cusp they go into the lower foci, and then they grind for particles like pestles and molars too. And then prebolus, bicuspids, intermediate function. Now let's see how many. As I mentioned you in the permanent dentition, what are the teeth? What are the different classes of teeth present in each quadrant? If you look at here, this is the midline. Okay, so these are 2 cutting teeth. That means there are 2 incisors. Okay, if you start counting from the midline, there are 2 incisors. Now, because this is located centrally, so we call this as a central incisor. This is also central incisor. Okay, so we have 2 central incisors in each jaw. The next tooth is lateral incisor. That is also a cutting tooth. The third one is, as I mentioned, C is a canine. The fourth tooth is first premolar. The fifth one is second premolar, and then you have first, second, and third molars, M1, M2, and M3. Okay, 8 teeth in the permanent dentition, and this is the same mirror image on the outside, and similarly in the lower also. Although the shapes are different, but the number and the names are same. So if you remember this, you can remember all other quadrants as well, which are the teeth located right from the midline backwards. Okay. Now this third molar, we'll talk about that later in due course of time, of course, the importance of that. Now when you come down to the deciduous dentition, as I mentioned you already, that we have only 5 teeth in each quadrant. That's why there's 1 central incisor, lateral incisor, canine, same. Okay, same. Central incisor, lateral incisor, that is 2 incisors, and then 1 canine. It's same as permanent dentition. But the deciduous dentition, they do not have premolars. Okay, there are no premolars in the deciduous dentition. They have only first and second molar, not even third molar. Okay, so you have central incisor, lateral incisor, canine, first molar, and second molar. Same in all quadrants. Altogether 20 teeth. Is that clear? Yes. Now, in order to remember those teeth present, we have developed a dental formula. If you remember this, you can remember everything. Easy for you. Okay? See, this is deciduous dentition. Remember this formula. I 2 by 2. Okay? Incisor, upper 2 and lower 2. And you can name them central and laterals. Then you have canine 1 by 1. Upper canine 1, lower canine 1. This is on one side only, 1/2. Okay? And then you have molars, 2 molars, upper arch and 2 lowers in that. And the other side is just mirror image of this. Okay, the other side is just mirror image of this one. Okay, and same thing for the permanent dentition also. You can see I 2 by 2, C 1 by 1. This is same as earlier. Now you have P 2 by 2 here. That's the difference. Okay, premolars 2 by 2, and then you have molars 3 by 3. Here only molars 2 by 2. Okay, now you also know what are the different classes of teeth present in deciduous as well as permanent dentition, and what are their locations and what are their names. So now when you go to your clinical posting, sometimes when you see patients' mouth, now you'll be familiar with all these things. It will be more familiar. Now, clinical notation. Clinical notation. Can you read out of you two, Susan and Bipana, who is interested in music? Out of you two, can you raise hand? Who is interested in music? You have raised hand, right? Great. Okay, I'll ask you to unmute. Okay, unmute, please. Unmute. No, doesn't matter. Doesn't matter. I'm not going to give you punishment. Don't worry. Okay, this just understanding. What is clinical notation? What do you understand by clinical notation? No, not clinical. Not forget about clinical notation. What do you understand by musical notation?
म्युजिकल नोटेसनमा चाहिँ कति धेरै कर्ड्सहरू हुन्छ अनि त्यसपछि रिदम्सहरू हुन्छ अनि त्यो कर्ड्सलाई चाहिँ हाम्रो जुन म्युजिकल रिदमहरूसँग म्याच गराउनलाई चाहिँ त्यो विशेष नोटेसन नोटहरू हुन्छ
नोट भनेको के हो नोट भनेको चाहिँ के हो त्यो द्याट्स व्हाट आई वान्ट टु नो नोट इज नोटेसन नोट भनेको कोर्स भनेको अलि एडभान्स भयो हैन कोर्स भनेको अलि मोर एडभान्स भयो लेट्स टक अबाउट द अल्फाबेट्स नोट्स भनेको के हो नोटेसन भनेको के हो
त्यसलाई केही उसले रिप्रेजेन्ट गर्ने वे होला
See, it's very simple, हैन you know I know you know that but you are not able to express I know that notation भनेको जुन साउन्डहरु हामी निकाल्छौं नि गीत गाउँदाखेरि म्युजिक बनाउँदाखेरि त्यो चाहिँ हामी चार्टै डाउन गर्छौं नि हैन डो रे मी फा सो ला सी हामी चाहिँ पेपरमा लेख्छौं अनि त्यो देखेपछि बजाएपछि त्यही साउन्ड निस्किन्छ नि हैन that is how do you note it that is how you know the sounds into the paper that may be C, that may be D, that may be or that may be sa re ga ma pa da ni sa whatever right similarly we can also note our different teeth in the your patient's record file suppose you examine a patient and you check it up and you want to note it down okay this tooth has disease this has dental caries for example okay the other teeth has dental caries then you can note it down so when your friend or your teachers or whoever comes next and reads that chart, you will say, okay, Vipana examined this patient and she has noted it down that, okay, right lower molar, first molar has dental caries. Okay, you can note it down in the chart. So when I see that that chart, I can understand that what is the problem with the patient. So that is what is actually clinical notation, how you note the tooth down into your chart. Okay, that's clinical notation. And how do you do that? That's what we are going to discuss now. That's how you are going to do that. This is very, very important. Okay. There are different types actually. You know, I've mentioned this different types because different countries they use different types. Americans use one system, British use another system. The other countries they use systems. So you may be getting the patients from different countries coming to you with the charts which they have noted down in their countries, and so you should be able to understand that because if you understand only one method provided you'll get confused also if somebody comes from other countries. So let me explain you about the different types of notations you can use, and I'll also tell you which we usually use here. There is another method is called FDI or Dental Federation notation. Now you know what is FDI or Dental Federation. That is our Federation of Dental Associations throughout the country, international. Okay, this is our big institution. Shall I continue or shall I continue?
Sir, participant-हरु join हुँदैछन् होला अहिले?
हैन मैले भनेको shall we continue or shall we stop it now? What do you think?
Continue गर्नु continue.
We'll continue for some time. Ask your friends and tell me. Okay? I hope everybody is listening and understanding, right? 72 भयो अब कतिजना बाँकी छ भन्नु त join गर्नलाई now altogether we have 72 here now. Okay? Is there some more there to join us? कतिजना त्यति हो? ठिक छ, we'll continue now. Okay, start. So thank you. All right. Okay. See, the first, one of the methods, I wouldn't say first, but one of the methods is Palmer notation method. The other one is FDI or Dental Federation. And then there is still another method that is called Universal Numbering System. Okay. So Palmer, Palmer notation method, I think is the oldest one. Okay. That is the one we have been using for a long time. You know, why we had to have another system is when the computer came into this world. Okay. When the computer came into this world, now this Palmer notation system could not be incorporated into computer. Okay. So that was the problem that time. Now that has been solved already. But that time it was a problem that we could not incorporate into the computer. So we had to be away from that system. And then there were other systems were developed which actually could be incorporated into our computer charting system. So that was the reason. Now in Palmer notation system, okay, in the Palmer notation system, this started by the Hungarian dentist Adolf Zsigmondy, okay, in 1861. Can you well imagine how old that was? And that is also known as Zsigmondy system. Okay, but I would easy to remember is Palmer notation system. Here, what we do here, that as I have mentioned you earlier, that we divide into 4 quadrants with the mesial line and the occlusal line, and then we name the teeth: central incisor, lateral incisor, canine, first premolar, second premolar, first molar, second molar, third molar. But while charting it down, instead of writing first molar, second molar, third molar, what we do is we write it 1. Suppose if you have to chart the central, right upper central incisor, we write these 2 lines and write 1. Okay, you write the cross like this, and then if you want to write 1 here, that becomes right upper central incisor. Is that clear? Is that clear? If you write this cross like this, and then if you write it 4, so that means it is right upper first premolar. Got it? Is that clear? Okay, good. I'll take a test. Okay, in a short while I'll take a test. Okay, so now this is what is for the permanent dentition. Okay, draw this line. Whichever tooth you want to mention, write the number there in the same quadrant. If you want to say, for example, third molar of left lower quadrant, then you write these 2 lines and write only 8. So when you draw this line and write only 8 without these things, write only 8, that means left lower third molar. If you write 7 here, that means right lower second molar. If you write 4 here, and then what happens? This is left upper first premolar. Clear? Is that clear? Okay. Now this is for the permanent dentition because we have 8 teeth. But for the deciduous dentition, it's different. Okay, we use the same quadrants, but instead of numbers for the deciduous dentition, we use alphabets, capital letters: A, B, C, D, and E. 5 teeth. You have ABCDE, you have ABCDE, you have ABCDE, and you have ABCD. That's the difference. If you write here this line, and if you write 1, that becomes right upper permanent central incisor. Okay, but if you write these 2 lines and if you write it capital A, that becomes right upper deciduous central incisor. That's the difference. Although both of them are central incisors, but if you write it 1, that becomes permanent. If you write A, that becomes deciduous dentition. Okay, that's clear. See, this is what is for the deciduous dentition. We have altogether 20 teeth. Okay. त्यसपछि अरूलाई पनि गर्नुपर्छ होला पाला पाला उहाँलाई मात्रै कति गर्ने कति टर्चर गर्ने हैन विभिन्नलाई उसलाई मात्रै Okay, now can you tell me this, which tooth is this? This one.
Right lower central deciduous incisor.
No, you're right, but the way you have to say is right lower. First, you have to mention the dentition, deciduous. Right lower, yes, central incisor. Okay. Submit. Samit Lamichani, can you unmute? Samit, can you unmute, please? Samit Lamichani, I'm asking you to unmute, please. Sunan, I'll go next. Sudan. Iti, go to Iti. No. Iti is there? Are you there? Iti, yes. Audio.
So right lower permanent central incisor.
Where is your photograph? I want to see your face. Come on, Hariom. Your video is not on. Anyway, you are correct. Anyway, you are 100% right. Very good that you have understood it. This is right lower permanent central incisor, right? Okay. Now another one to Susan. Third one.
Left upper permanent molar, first molar.
Can you repeat that once again, please?
Left upper permanent first molar.
Very good. Excellent. Now back to Bipana. Back to Bipana.
Left upper deciduous second molar.
Yes. Whenever you see alphabet, you remember this is deciduous. Okay, don't forget to say deciduous. Alphabet. Left upper.
Deciduous second molar.
Exactly. Okay. Now I assume, and I'm almost clear that all of you have understood this. So we'll move ahead. Okay. Now we're going to another system now. Okay, another system. That is what is FDI notation system. Here, what we do actually, we don't use these lines here. Okay, while noting it down, we don't write these lines, but we name the quadrants. For the permanent dentition, we name the quadrants as quadrant 1, then go to the left side, quadrant 2, and then quadrant 3, and then quadrant 4. And then when you go to the deciduous dentition, we go above 4, that is quadrant number 5. When you say quadrant number 5, this means right upper deciduous quadrant. This is quadrant number 6. This is quadrant number 7, and this is quadrant number 8. Is that clear? Okay, that's clear. Now, when you want to write some teeth, note it down. When you write a clinical notation for one of these teeth from the right upper permanent quadrant, what you do? First, you write the name of the quadrant, 1. Okay, instead of writing all this, you write 1. And then write the number of the tooth from 1 to 8. If you want to say central incisor, write 1, 1. You don't say 11. Remember this. You don't say 11. You say 1, 1. Means this one. When you say 1, 2, that means lateral incisor. When you say 1, 3, means canine. When you say 1, 4, means first premolar. Right upper first premolar. Okay. If you want to say, they say the last molar of this quadrant, you write 3, 8. When you say 3, 8, that means it's the third molar in the left lower quadrant. Clear? Okay. Similarly, if you want to write the clinical notation for deciduous dentition, first you write the name of the quadrants. If you want to mention some tooth here, first you write the quadrant. If you want to mention teeth from this quadrant, you write the quadrant number first. So when you write 7 and 2, I will understand that this is a tooth which is second incisor belonging to the left lower deciduous quadrant. So how would I say that? Left lower deciduous lateral incisor. Clear? If I want to mention, say, if you want to do a clinical notation for, say, this tooth, this is what is actually right upper deciduous canine. So what do I write this one? How do I write this one? I write 5 and 3. Okay. But if I want to mention the same right upper permanent canine, then what I have to do is I have to write 1 here, and then I have to write it 3. 1, 3. If you want to write central incisor here, deciduous 5, 2. But if you want to write central incisors here, you write 1, 2. That's the difference. So you have seen 1, 2, and 5, 2. Both of them are lateral incisors, but one is belonging to permanent dentition, the other one is belonging to the deciduous dentition. So here you write the quadrant, name of the quadrant first, and the number of the tooth. There's no alphabets here, like in the previous system, Palmer notation system. Okay? Now this is test for you again. Once again, there's a test for this. This is the federation. Get ready for this. Study this and get ready to answer. Prahlad, please. 962 roll number, please unmute. Okay, next. Yes. The biological would like active Susan like okay, Susan, back Susan. Okay, Susan, can you tell all this on the left side one by one?
Right upper permanent central incisor.
Very good.
Left upper permanent canine.
No, this is 2.
No, lateral incision.
Yeah, lateral incisor. Great. Okay, and then next.
Left lower permanent first premolar.
Okay.
Left lower permanent first molar.
Great. Very good. Next line.
First focus say right upper deciduous central incisors. And second को चाहिँ left upper deciduous lateral incisors.
Excellent.
अनि त्यसपछिको चाहिँ left lower deciduous first molar. अनि
What one?
Sir, left lower deciduous first molar.
Good. Okay, you have to say the dentition first. Okay, deciduous. Okay.
Yes, sir. अनि के भन्छ अरे right lower deciduous second molar.
Okay. All right. Very good. Now you have understood it. So let's go to the next system also. That's American system. Universal. We call that as a universal system. Okay. And then this is usually followed in states. And Americans follow this. They are on their own. They don't follow anybody else. They follow themselves. They have their own systems. What they do in the American system, in the universal numbering system, which some other countries also follow, they start the numbering tooth from here, right from the upper quadrant, the last tooth, third molar. Okay, they name it as number 1. So you start from the right upper quadrant. Just imagine your own right upper quadrant, the last tooth. That means third molar. Okay, third molar is numbered as 1, and then you come in front one by one. Second molar, first molar, and then you have second premolar, and then you have first premolar, then you have canine, and then you have lateral incisor, central incisor, and again the same thing. It goes like this: central incisor, lateral incisor, canine, first premolar, second premolar, first molar, second molar, third molar. Same thing here: lower central incisor, lateral incisor, canine, premolar first, premolar, second premolar, then first molar, second molar, third molar. Same here: central incisor, lateral incisor, canine. So this is how it goes. So you start from right upper last tooth 1, and then you come all along like a circle, and then come down to here. Okay, to the right lower last molar. Okay, so this is how you do. So when you say here 9, when you say 9, that means left upper permanent central incisor. Okay, when you say 60, that means left upper permanent third molar. And when you say 20 here, left lower, second permanent premolar, second premolar, because there is only permanent premolars. You don't have to say permanent for premolars. Okay, so this is how you do it. Similarly, after 32, 33, 34, you go for the deciduous again. Okay, like this. So above 32, you have deciduous. 33, 34, 35, 36, 37, 38, 39, 42, like this. Okay, you can practice this now. You can practice this. So you have only numbers here. You don't have to write this. Okay, in the second and third system, you don't have to write this. Actually, the reason why these two systems were developed, because this thing could not be incorporated into the computer in the beginning days. That's why they have developed this system, both systems. But now they have developed this also. You can click it and put it here and write the number of the teeth also. So you can use in the computers all systems now. Now let me explain you a little bit about your anterior, which are the anterior teeth and then which are the posterior teeth. You know, now all those teeth which are approximated with the lips, right up to the corner of the mouth. Okay, all these teeth are anterior teeth, which includes central incisor, lateral incisor, and canines. They're all anterior teeth. And then remaining teeth all are posterior teeth. So they can be grouped into two groups: anterior teeth as well as posterior teeth. Okay. Well, this guy needs filling of the anterior teeth. You can say that also sometimes. Okay. Well, he have problem in the anterior teeth. He has cavity in the anterior teeth. But that belongs to canine, from canine to canine. Okay. So central, lateral, canine, and then you have premolar, and molars are all posterior teeth. And then once you talk about the roots, okay. So we have talked so much about the crown here. We have never talked about the roots. Okay. Now, if you look at the roots here, the central incisor has one root, single root. Lateral incisor also has single root. Canine has also single root. This is the longest and the most stout roots, and this is the last one to go from the oral cavity also. Canine, because this supports here, gives very, very important from aesthetic point of view also, as I mentioned you earlier. Not only it gives male, female, or devil's look, but also it supports the corner of the mouth. If you don't have canine, this will just be depressed, and you will not look very handsome or beautiful wherever you are. So it gives supports the tissue. This is very, very important to canine. So this will be the last tooth of choice for us to extract. We don't extract canines so easily on this where compared to so. Okay, very, very important. Okay, it supports it and also gives devil's look, male's look, female's look. Okay. No, I think shall we stop right now because it's been quite long. We'll continue next time. Okay. There's still many things. We'll continue the dental anatomy, and once we finish anatomy, we'll go into the different diseases. You must be now tired by now. Your brain must be quite saturated. Okay. So I would like to request you to practice these clinical notations. We usually use the Palmer notation method, most of the times, But then we also use what do you call that as a dental federation systems also. What I want to say here, in Nepal, we have not even been able to use one single notation because we get trained from different schools, different. Some study in Philippines, some study in India, some studies in Bangladesh, some studies in Pakistan. So many different countries they are qualified in. So they use their own system. So we have to still go for one common system that will be defined for the Nepalese dentist. That will come in one day. But the first and the second systems and sometimes third systems are also used. Okay, but you practice all those things. Okay, thanks for listening. Have a good day and see you.